Jim Joyce. I had to clear my throat. Last couple of times I've been off here and there.
Infused. I'm infused with Eugene enthusiasm.
Woo. And right back at you from that perspective. I look forward to our Wednesdays. I know we've been skipping our quick one-on-ones on Mondays. Just lots going on for both of us because you're very busy. I saw you ringing the bell. I was a little envious. Then
invited you.
I know. I really wish I could be there with you. Then I was invited to as well to your vision event that we've talked about with some of the guests. So give us like 30 seconds on your Mr. CEO travels.
Yeah. So, well, as you know, we listed on Euronext back in December of 21. So we listed, and what you can do with your stock is you can have it become traded in the US through what's called an over-the-counter. So it's like a foreign share that you can trade it. So you can now. So we rang the bell in Wall Street that our stock is now formally trading in the US under the ticker symbol HBCNF. Any kind of smart investors out there? Well, I can't promote it in that sense.
No.
So it makes it accessible now to US investors, whereas smaller institutions, family funds and things like that might have had to open up a European account. So it's exciting. So we launched it, then we went to we booked the reception room. We're not yet trading on the NASDAQ, but we booked a room at the NASDAQ and brought in 40 of the finest, kind of we call friend of Health Beacon fobs, to the event.
Yeah.
And then right on the heels of that, because we didn't have enough going on, we had our first kind of inaugural kind of stakeholder event called Health Beacon Vision event. We had 100 awesome people in Boston, Beacon Hill, and we revealed the details of our new product that's coming out. So as a company, we're going to start moving from injectables into other forms of medications like oral. So,
awesome.
So anyways, that's it. 30 seconds, a little more than that. That's what's going on a lot.
It's all right. We'll give you. I mean, it's our show, so we can do whatever the heck we want to do. But
let's let our friend in here.
We'll do our show and tell. But let's let a dear friend, Rasu Shrestha, is joining us. And usually when I say like Jim Joyce, where in the world is Jim Joyce, and vice versa. But Rasu is joining us from Rasu. Welcome.
Where's he?
Here
we are.
Whoa! Oh man. Hold on a second. I'm gonna go get a jacket because this is not gonna work.
So what are we rocking today? It says rock the Casbah.
Yeah. What else would it say?
Yeah,
very appropriate for Hump Day, right? It's Wednesday. I see a camel. There we go.
Yeah.
Leave it to Rasu. I don't know if you two met, but leave it to Rasu to find a great analogy and just put it out in the world. So love it.
Good to see you. Good to meet you, Rasu. Have we been at Health Excel events or something together, or?
Our paths must have crossed in the
well, great to see you.
Good to see you here as well. Yep.
Awesome.
Rasu, I know we've been, we typically are very meticulously unproduced, but we do try to give a little bit of a warning to guests. So we finally have you on, which is awesome. I think we've been speaking back and forth and having you on for a while. But, for our millions of listeners and viewers, take us through your story. And then Jim and I, as usual, will interrupt and with some curiosity.
Well, absolutely. So chime in anytime. Well, really excited to finally be on, and excited to speak to the both of you. So my journey is one that really has been spurred with curiosity and passion, and a desire to make a difference, right? And it is not unlike a lot of us that are doing what it is that we're doing in transforming healthcare and really trying to get to the root of some of what I think are some of the more pressing challenges in our industry. But I started off my journey as a physician, right? So I went into med school. Ever since I remember, from way back when I was a kid, I always wanted to be a doctor.
Awesome.
And that was primarily driven by my desire to make a difference in the life of a person and to create impact. And that's what drove me to med school. Went into radiology and embraced informatics and IT, and then got into the space of innovation and strategy and transformation. And it's been quite the wild journey in the last 3 decades, but it's all been driven by that innate sense of curiosity, a desire to really make a difference, and the passion to just connect at a very human level, so that we can make not just incremental change, but transformational change, which I think is really important, especially in the industry that we're in.
And where'd you grow up, Rasu?
So mine's a pretty long story here, right?
We got time.
We got time? Okay, all right. So I was born in Kathmandu, Nepal, right? In the foothills of the Himalayas, I say, and I ran, rolled downhill from there to, no, not literally, but
we have the Casbah, we have Kathmandu.
There you go. That's right. Yeah, from Kathmandu to the Casbah, right? That's the title of our episode, maybe. But, so look, I was born in Kathmandu, Nepal. My parents left when I barely started school, and I grew up in Southeast Asia, in Brunei, Malaysia, Singapore, that part of the world.
Okay.
I speak 5 languages, Malay being one of them. I went to college in Malaysia, Subang Jaya, just outside of Kuala Lumpur. Really enjoyed my time there. I was in India for my medical training earlier on, went back to Brunei and then London, right? So radiology, informatics, all that. So London for a while, and did some work with Imperial College. And it was an informatics fellowship that really hooked me to some of the elements of what we're doing here around health IT and innovation and transformation. Then I was in Los Angeles at USC, charged with informatics there, and really enjoyed my time there. And while I was busy doing all of that, got my MBA at the Marshall School of Business. This is some time back. And, it was, again, remarkable in Los Angeles. Then Pittsburgh came calling, so went to Pittsburgh and was there for 12 years.
How many times we've had a guest on here to go from Kathmandu to Brunei to LA to Pittsburgh? I mean,
all the time.
Like it's like all the time,
I have to give a shout out to my colleague from Bayer, Priscilla, right, who still there, but she kind of dragged me at the time to Pittsburgh, not because I didn't want to go, just more. And I honestly, I love the city. I really love the city, and actually
really
the startup
urbanizing.
scene.
It's kind of.
I mean, it's just beautiful. Like that's my kind of like with the bridges and the water. Like I don't know. While it's different from Amsterdam, for me it was kind of like okay, the bridges maybe, but anyway, just really loved it.
Did you like Pittsburgh, Rasu?
Oh, I love it. I really enjoyed the 12 years that I was there with my family. My boys love it. Ruchi, my wife, loves it as well. The older one was born in Pasadena in Southern California. The younger one was born in Pittsburgh, but because they grew up in Pittsburgh, that's all they know, right? So we all as a family still bleed black and gold.
Awesome.
It's interesting when we made the transition to the Carolinas, as part of my kind of landing here. We gave the boys a tour of the Panthers Stadium here, right? This is the Bank of America Stadium. And then I was having a dialogue with my CEO, my boss here, and he asked me, "Hey, so do the boys have a new favorite team as it relates to football?" And it was the boys who tactfully but very correctly said, "I think we might have a second favorite team."
Well positioned. And what was that movie? What was that movie with the kids playing football in Pittsburgh? It was like Tom Cruise was in it. That was that.
I'm horrible with it.
I'm pretty sure it was like a suburb of Pittsburgh. There was a famous one growing up, but
it doesn't come to me right now. But there've been many movies that have been shot in Pittsburgh or with Pittsburgh as the backdrop, right? Including all the Batman movies.
All the right moves. All the right moves.
There you go.
All the right moves. Yeah, that's a great football. Coming of age football movie, right?
Just a quick thing. I don't know if you ever. I don't really watch or listen to Joe Rogan, but every time I've seen or whatever, he's always like, can you like check this? And he sends it over to someone to Google it.
Jamie.
We don't have that, so I just had to Google it. So.
That's
great.
awesome.
Yeah,
All the
but
way.
Batman, right? So I remember just in one of the many meetings that we're having there, Batman was being shot in downtown Pittsburgh, and that was like the most convenient excuse for anyone, because I'd be driving to the U.S. Steel Tower, which was the headquarters for UPMC, and would be stuck behind a Batmobile. And I kid you not, right, in the middle of summer, that have this fake snow, because some of the scenes were in the middle of winter.
Right.
And it was quite fascinating to to see Anne Hathaway coming down the steps in her bike, and to be stuck behind a Batmobile, and it was quite something. But yeah, great memories with Pittsburgh. But I enjoyed my 12 years there. And when Charlotte came calling, I rose to the challenge of really embracing some of the opportunities at Atrium Health. So really excited to be here.
Cool.
One quick comment. I think you said it earlier that for the 30 years that you've been doing it, I was going to comment like, did you become a doctor at 10, man? Like I'm not trying to compliment you, but it's it just and somebody said like oh, so and so was is not, it was 1989 or something, right? And I thought like 20 years ago. No, it's like the time is just flying. It's crazy. Monday through Friday.
Right.
So fast forward, I mean, I think we've been in the same circles, kind of the digital health, and this is the shout of digital health therapy, right? So yes, it's an intervention still for Jim and I every Wednesday.
We're gonna suck your enthusiasm out of you.
And it's great, and it's great to have a doctor on the other side of the screen. So, but there's lots of promise. There's evidence. Like I'm actually, on the ground in one of the largest health systems and a health system before. What are you seeing that's real? What is not? How do entrepreneurs look at it? Do we see different breeds of is there maturity that we're seeing? Just honestly curious, I mean, it's your take on the ground, for lack of a better term.
Well, yeah. So thank you. I appreciate that question. And, I think about it from the perspective of where we are in this moment in time in our journey through, really transforming the future of health and care, and where we are is we're hopefully on this other side of the pandemic, having learned all of the stark lessons that the pandemic has taught us, right? And I think more than anything else that's happened in the last 3 decades or more, it really has been truly eye-opening for all of us, across this one global entity that we're a part of. In how we've lived through the pandemic, and how digital health has taken shape, right? It really has been challenged in so many ways, but the opportunistic ways in which we've been able to expedite some of the core fundamentals of how we've embraced digital, right? Within days, we're able to, for example, stand up an AI-powered chatbot right at the thick of the pandemic here at Atrium, virtual, like almost every other health system.
Where before it would have taken 24 months cycle, right? Just to go through all the processes and.
Yeah, absolutely. And what was really interesting in that embrace, the massive embrace of digital through the pandemic, was not just kind of the quote unquote overnight success story. You snap your finger and suddenly it's on. I think it, in large parts, for those who did it well, for those who did it in such a way that it is sustainable and scalable now on this side of the pandemic, I think it was a lot of, what was the preparedness that went into the pandemic? Not that anyone knew that the pandemic was coming, right? So for example, at Atrium Health, we'd done a lot of work, in standing up what we call Virtual Edge, our virtual health platform, and the various set of capabilities around all of the services from synchronous to asynchronous virtual care to all of the capabilities that we turned on and really scaled through the pandemic. But it was also about, from a strategy perspective, because I'm a strategy guy, really making sure that we weren't just turning on a chatbot or, enabling a larger, well-scaled virtual video environment. It really was about strategically connecting the dots across the care transformation agenda. And from an economic perspective, making sure that we're able to have the economic drivers aligned to it as well. So we have this strategy called Connected Care Everywhere. And as the name would depict, it really is about, what does care beyond the bricks and mortar facilities of a health system really look like, and how do we bring in all of the components of remote patient monitoring and all of the elements of kind of this flip, right? It's not just episodic care anymore. It is always on, ubiquitous, 24/7 care that we need to be embracing. And what are all the economic drivers, not just the digital elements, as well as the care transformation elements that we should really be embracing. So it's thinking through it, not just as one shiny object that you go after, but really in a very ethereal, in a very holistic, in a very well thought through manner.
And when you think about like just digging into your area of study and practice within radiology, what's the state of, because radiology, wasn't that the promising, kind of pioneer of digital healthcare, where everyone talked about this capacity to read scans, from anywhere in the world, and you can hide. Where is that at right now? Is it all happened?
Yeah, no. So radiology
It's in the past.
Really first to the dance there, as it relates to embracing digital. We were,
right.
Really one of the first, if not the first specialty to embrace digital in the way that we did, right? PACS in its
right.
early days, the picture archiving communication systems, RIS, the radiology information systems. We were the earlier pioneers in embracing that, right? Really
right.
one of the first to move from analog to digital.
Right.
I still remember those days where we had those alternators, those, the V boxes that you still see on TV and on every movie. I'm like, no one uses those anymore. Come on,
Yeah.
But what's interesting, and maybe this is symbolic of also the embrace of digital in the rest of healthcare in the decades to follow, has been kind of the hesitation to let go of the past and some of the cultural paradigms that we continue to struggle with in the embrace of digital health in healthcare, right? So case in point in radiology, I talk about this all the time where, we still call it hanging protocols, right? So you double click on a study in our work list on the workstation and you hang it in the digital, the high fidelity diagnostic monitors. But we're not hanging anything, right? And we still call it a wet read, and we still call it film and paper. It's charts and tabs. And like, all right, hold on. It's all of the nomenclature that we were used to in the analog world that we were not able to let go of. So so if I broaden the aperture well beyond radiology, and maybe this is a wake up call, right? This is where we as an industry need to let go of some of our older paradigms. I challenge my teams all the time and say, all right, what are you going to unlearn today? Not just what are you going to learn today? And I always say, hey, for the longest time, we've been doing digital, right? We say, hey, let's do digital, right? Do digital through the pandemic. Let's do digital. Let's embrace digital. But I think it's not just about doing digital. It is about being digital. And being digital and doing digital are two quite different things. Being digital is really about thinking in zeros and ones, not just replicating analog workflows, analog paradigms, analog mindsets with digital, but it really is about thinking in zeros and ones. It is about representing information and insights in ways that we could never in our film-based and paper-based world.
Right.
Though I do wish I can just do the round swipe.
Yeah, like people go like this to represent the phone, but your phone doesn't look like this.
You don't get a busy signal anymore.
I mean, old habits die hard, right? It's I actually wonder, like, what are little kids doing these days as that? Is it still this? I don't know. Swipe. I need to pay attention.
Swipe.
Swipe away.
If you look at my two boys, my older one especially is a sophomore in high school already, and he's snapping away, and he's he embraces technology, and these are digital natives we're talking about here.
Yeah.
So you mentioned connect care anywhere, right? And and I'm saying this, not you, but I mean generally, if you look at a P&L of a large health system, the money and the revenues do come from surgeries, quite heavily. Now there's discussions around, to your point, you guys have deployed, telemedicine platform, kind of the lines are starting to blur between kind of primary care, virtual care, hospital care, right? It's an ecosystem. There's now payviders, right? The concept of them, and then comes hospitals at home, right? Just again, as a strategy guy, right? Curious on your thinking on those lines blurring, and then maybe focusing on hospital at home, because that's been a hot topic recently.
Yeah,
right?
no, for sure. So connected care everywhere is our strategy. And when you think about the need for us to really embrace not just a different mindset, but also a different way of looking at healthcare in how it is offered to our patients and our consumers and our communities. It is about broadening the aperture, right? So for the longest time, healthcare has been about sick care, and I would challenge that assumption even further and say, there hasn't been much care in any case, right? But let's assume that it's been for decades at a time, maybe centuries at a time, really focused in on sick care.
Right.
You broaden that aperture a little bit, and it's about preventative care. And you broaden it further, and it's about well care, right? But I would challenge those assumptions further and say, really, at the broadest sense of that aperture that we're opening up, healthcare should really be about living your best life possible. And I think that's where the economic models really then start to align. That's where some of what we're seeing out there in this continuum of care and engagement, and meeting the needs, the hearts, minds, and desires of our consumers, who are sometimes patients, but all the time people.
Right.
That's where I think we really need to be focused in on as a healthcare industry. And so, I simplify it by saying, hey, look, for the longest time, we've been focusing in on patient-centered care, and the patient is still in the middle of that care paradigm, but really the focus is on person-centered care. And that's where hospital at home comes in as well, right? Because in the thick of the pandemic, we were able to stand up all of the different elements of the hospital at home program here at Atrium Health. This is one of the most, in fact, the largest hospital at home program in the country at this point. We were granted the CMS acute care home waiver way back in March of 2021.
Okay.
We published, quite a bit in the Annals of Internal Medicine and a number of other journals in the work that we've done. It is one of the largest, also with an education program that's affiliated with it. So it's just remarkable. But we were standing it up to essentially meet a dire need at that time, and that was for us to manage the craziness of what was happening at that point, right? So COVID patients and COVID presumptive patients coming into our hospitals, our inpatient beds and ICUs just filling up to the brim, and what it was like, right? We're talking about and thinking about going into the stadiums and the pop-up clinics and all of that. Right. And we said, all right, we need a better way to manage this. So we built almost overnight our Atrium Health Hospital at Home program and created this integrated model with 2 virtual floors separated by level of acuity, right? Staffed with separate care teams that included physicians and APPs, and registered nurses and PharmDs and social workers and paramedics and remote patient monitoring. And we had kind of the first floor, or the virtual observation unit, the VOU as we call it, designed for low acuity patients who can be managed remotely with daily telemedicine type support, symptom monitoring by primarily the RNs, the registered nurses. And then the second floor, again, the virtual second floor in this hospital at home, right? So this is in the comfort of our patients' homes. Be the virtual acute care unit, the VACU, designed for patients who would otherwise have been admitted to a traditional bricks and mortar hospital, providing inpatient care such as oxygen and medical treatments and daily virtual physician rounding and virtual vital sign monitoring and twice daily nursing assessments and daily paramedic visits. So it was really remarkable how kind of almost in a snap of our finger, we're able to stand up this service and these capabilities, and then scale it in the manner that we've done, really in a way that no one else has across the United States. And what's even more interesting is where we're taking it from here.
And sorry, I'm curious on how much of that is being used, right? Because again, when you stand something up in a dire need, and then because we've seen some of the numbers even on telemedicine, obviously spiked, leveled off. Again, I'm not keeping track of a lot of this, to be frank, but I'm curious on the hospital at home and that virtual VOU. I feel like just from a convenience for everyone, it should continue, but I'm sure people also want to see their doctors face to face. Yeah, humans.
Yeah, no, absolutely. So the good news in this is that it has continued to grow on an upward trajectory in terms of the embrace of our Atrium Health Hospital at Home program. And we've saved, thousands of hospital bed days, serving thousands of patients across the board, and it continues to be on an increasing trajectory. What we're doing at Atrium is not staying still, right? Because we know that we are now getting on this side of the pandemic, and the real impetus for us is to take all of the innovations that we put in place in our hospital at home program and say, all right, where is it going from here? How do we embrace a much more holistic strategy? And we've already been putting in place a number of core elements around, care management workflows, device management, patient monitoring and escalations, driving better patient and consumer engagement, and then all of the analytics and interoperability capabilities, really focused in on home, right?
Yep.
Home is where the heart is, right? And we're seeing a lot of these elements happening in the industry right now around, others investing in home and home care. But what we're really betting on is the future of where health happens at home, with remote patient monitoring and virtual care and advanced analytics and in-home clinical care services, really then seamlessly integrated with this orchestration layer with additional support services and cross-continuum care, which I think is really important as well. So it's not just a standalone service that any pop-up mom and pop clinic would provide from a home health delivery perspective, but it is tied back to the seamless orchestration layer for additional support services and cross-continuum care, which I think is important because we're human beings, we break down, but we want to provide care in the comfort of the home, but we're always there from a catchment perspective when and if you need to come to a hospital facility for anything else beyond what can be provided at home.
In the just playing off what you said before and like getting people to not use words, what are you going to unlearn? Is it going to be a hospital in the home? Like, would I really want a hospital in my home, or, to your point, like, would I want like health in my home, or like my best life?
We're calling it health at home, and it encompasses a lot of different elements of not just the core components of hospital and the things that you associate with a hospital, but we ask our patients all the time, and our consumers and our community members, what matters most to you. Right. Not just what's the matter with you, because that's what rolled off the tongues of doctors everywhere, but what matters most to you, right? And what we heard loud and clear were health and happiness, living independently, healthy aging, financial management. I mean, how do you manage living on a specific budget and the rising cost of rent, home costs and healthcare costs and all of that? These are real priorities. So we're really focusing in on these drivers of health and making sure that we're bringing together a set of services and capabilities to really meet the needs of what matters the most to our consumers.
It's interesting. One of our guests, I don't know if you know him, Gautam Gulati, started as the well home, and even thinking through like interior wellness design, right? Like the whole concept of it is where you live, your atmosphere, how even your home set up, what other people in your home eat, right? Because we all may have different habits. So back to this kind of well at home is actually, or being, I think you even said this before, preventative care and then well care, right? And so it's all about just health, just being healthy and happy.
They could use a lot of healthcare coaches, right, Eugene? They could use a lot of...
Hey, listen, you said it.
Who's doing
You said
that.
it. You said it. Love it. So before we go to Jim's famous question, I got one more, and I've seen you tweet about this, and I do think, I know, doctors, physicians on the front lines are humans too. And I did, it wouldn't be if I didn't talk about this, especially with you, around burnout, right? I honestly don't know how docs do it. I really don't. And I've seen you tweet quite a lot about it, and just wanted to hear your thoughts on where that's going and how do we help as individuals.
Well, thank you. I appreciate the question, and there's the opportunity to bring a little focus into the issue of burnout. And through the global pandemic that we've been living through, and we're still living through, has been the epidemic of mental health and epidemic of clinician burnout, not just physician burnout, but think about our colleagues and such as well. And so the reality is that, look, it's not getting any easier, right? And especially in the environment that we're functioning in today. And that's why I continue to challenge ourselves to broaden that aperture and think more holistically about the person and not just the patient, so that we can change the paradigm altogether. Because I got into healthcare as a physician to make an impact on the life of that person, right? And it's oftentimes we get into healthcare for all of those reasons, but we end up being someone who's just stuck in documenting and billing and kind of the transactional elements that have defined the reality of healthcare today. And I believe in the heart of my hearts that we really need to elevate ourselves from the transactional elements of healthcare to more of the experiential elements of healthcare. Experience matters. And this is not just for our patients and our consumers that we deal with on a day in, day out basis. We talk about engage me and hear me and know me, right? But it is also about our clinicians, our physicians, our nurses, and others. And it's important for us to focus in on their experiences and how we're able to, utilize technology not to be an impediment to better care, but to really be an enabler of better care. Because for the longest times, technology gets thrown at clinicians.
Yep.
And we're just expected to, grin and bear with it, right? So there's free pizza, you come in for training, there's a cheat sheet, and then you live with it. And we're not, co-participants in designing those workflows. We're not co-participants in building those solutions. And so, that's what we've been focusing in on here at Atrium Health. We have this program that we stood up right about the time that I joined with Dr. Scott Rismiller, my partner in crime. He's our chief physician executive here, and we call it the Best Place to Care program. And that really takes into account all of the different elements of how do we head on address these issues on the ground, and how do we make sure that we're able to programmatically and systematically have the right elements in place so that our clinicians do really feel that this is the best place to care.
Amazing. One quick comment on that: instead of the pizza, should switch to like broccoli or something. I don't know. just a side note about health.
Broccoli.
But
Too soon. Too soon.
Well, we're getting into Jim. I'm gonna hand this off to you to your last famous question at the end of every episode.
So go with me here, Rasu. Imagine yourself at a Panthers-Steelers game, and your kids are torn because all their buddies are rooting for one team, but they're, as you said, black and gold. They're black and gold. You're sitting at the game, and this doctor runs out into the field and and helps one of the the players, and then runs back, and you see him walking out, and he goes, Russ, is that you, Rasu? He says, I'm actually a former radiologist right now, and I'm just doing this as a side gig, and I'm from Kathmandu, and I trained in Malaysia. I spent some time in LA, and I'm starting my own healthcare at home digitization, digital health project. And what would be the one piece of advice would you give to that young radiologist, Kathmandu entrepreneur?
My message really would be around resiliency. I think the need for us to have, resiliency as a core fundamental of a budding entrepreneur, I think is so darn critical. It is hard. Healthcare is hard. I mean, we all know this. We've seen the biggest and the best come into healthcare to solve for healthcare and fail miserably. So, it's one thing to have vision, but I think it's also really important to have composure and bring in the right reasoning, but also bring in the right levels of collaboration, right? Who are your networks? How do you make sure that you're able to manage perceptions and bring in the social context in those collaborations that you're formulating? And then I think one key element of resilience too is tenacity. I think it's really important for that younger self of me to understand that doing this requires a bit of resilience that's backed by tenacity, right? Persistence, having a healthy dose of realistic optimism, and the ability to bounce back. I think that's really critical as well. So, a bit of a reality check, because we all come into this with such gusto, and we're like, anything's possible, and anything is possible. But it is important to have a healthy dose of resiliency built into kind of the fundamentals of who it is that we are as entrepreneurs and as doers.
Awesome. I love it. Composed tenacity. That sounds like you. Composed tenacity.
Always the wise words from Rasu Shrestha. Thank you. And
thank you
for being with us.
No, I really appreciate it.
And for all the listeners and viewers, hit subscribe, pass it on, and see you next week.